Guys, welcome back to another episode of A2 the show. Today we have a brand new podcast with Angela Ardolino.
Yeah.
Angela Ardolino is an American holistic pet wellness expert, entrepreneur, and educator known for promoting natural plant-based healing for animals. With over 20 years of experience, she specializes in alternative therapies like cannabis and medicinal mushrooms for pet health, inspired by her own journey with rheumatoid arthritis. She's the founder of CBD Dog Health, Myco Dog, and Fire Fireflake Farm, an animal rescue sanctuary, and is also a certified medical cannabis specialist, speaker, and podcast host focused on educating pet owners on holistic care. Now, Angela, when we were doing our research on this and we stumbled upon your account, we were definitely intrigued by how different, yeah, this what you work on is. Like, to be honest, it was really strange for me. I'll just be I'll just
And
say that
unique for
because
sure. Stuff I've never heard of before, too. And I couldn't find other
exactly.
stuff like it online.
My first question, to be honest, that crossed my mind is when you give these kind of treatments to animals, it's obviously a whole different aspect when dealing with human beings. Is it considered animal abuse or like what's what's the situation when you're giving these kind of treatments like medicinal mushrooms and CBD to animals who don't necessarily can't give consent about it?
What a great question, and what a great way to think of, things like this. I love that you're saying that. So, first of all, I'm a clinician, period, and for humans and for animals. And animals, especially dogs and mammals, are a lot like us. So a dog's brain, a dog's gut, our endocannabinoid system, which is this master system that we all have in us. That's what I concentrate on. And this system is the master system in our bodies, both animal and human. And our doctors and veterinarians are taught nothing about it. It is the system that's in charge of all of the other systems in our body. So when we have a respiratory or a cardiovascular or endocrine system issue, when we just focus on that system and not on the whole body and this master system, we never get back to homeostasis and health. So your question is, when that I'm guessing your question is, am I experimenting on animals with these things?
Yes, and
And
the
no,
ethical
I am not.
background, like the ethical question on it as well.
Yeah, the ethical question should be the other way around, that we are experimenting on animals with chemicals and pharmaceutical drugs. Every pharmaceutical drug comes from a food, plant, or mushroom that did the trick, but you can't patent nature and make billions of dollars. So they take what works in nature and they go into a lab and they try to recreate it. That way it can be their patent proprietary formula, but the problem with that is that the body never recognizes those things. The body recognizes real food, real mushroom, and real plant medicine. When you give it a pill, a pharmaceutical drug, it may have an action, but it always has a side effect because it's not natural and the body doesn't recognize it. And therefore, the body has to work overtime to figure out, what are these chemicals? Do I keep them? Do I get rid of them? And you're causing your detox pathways, your liver, your kidneys to work overtime when you take these drugs. So it's actually the opposite. Giving them natural, real food, plants, and mushrooms is the ethical thing.
Tell
It's
them,
called
Angela.
zoopharmacognosy. What do you think wild animals do when they get sick? They don't go to a
I wouldn't know.
hospital. They don't go
Okay.
to a doctor. They go out into
Ah,
nature and they go find that food, plant, mushroom, dirt, whatever, and they eat it. And they bring themselves
Mm,
back to homeostasis because they
wow.
know. So it's called zoopharmacognosy, and we've gotten away from that. I'm trying to get back to nature. So, how I
okay.
discovered the endocannabinoid system and why I'm such a big advocate and do this for my life is because I was diagnosed with rheumatoid arthritis in 2015. I had already thought I'd cleaned up my diet, thought I'd gotten removed a lot of the toxins in my life. And here I am with this autoimmune disease. And so I immediately went to go, okay, if I gave myself this disease, how do I reverse it? So learning about the immune system, discovering the system was the key. And I literally went out to go see what could I take naturally that would have the same action as the pharmaceutical drug that they were prescribing. And that pharmaceutical drug was Humira. And that drug is linked to lymphoma as a side effect. So I'm not interested in getting cancer to help my pain from my, rheumatoid arthritis. So I'll never forget it. The first time someone gave me a FICO, which is full extract of cannabis oil, and then a tincture, and I put it in my mouth, and I literally within a minute felt pain leave my body. I literally felt myself go from to and I was like, what the heck is this? All my pain just disappeared. My stress and anxiety levels are like gone down. I feel great. I'm not high. So I needed to know more. So that's when I started to really look into it, educate myself. I had a media company at the time when I was literally like teaching people how to remove toxins from your life and how to live a more healthy life and natural life. And so I wanted to know more. So I started interviewing people that have been using it for medicine for years. And since my media company was family oriented, they were moms. And they were moms that were treating their kids' seizures, cancer, you name it, with the same thing that I just took. Wow. So I wanted to know more. I needed to know more. I literally sold my business and threw myself into the industry, having no idea where I would end up. And now what I know, whew, it's incredible.
Because like you describe, it is natural, right? I mean, we somehow separated ourselves and our pets from the natural world. I mean, all our pets, they're animals, and maybe they're not wild animals, but they are animals. And in the wild, animals eat all kinds of plants and mushrooms and all kinds of things that are natural, and they've been living and thriving in that way for, all of time. So it totally
and
makes
that's what
sense
we're supposed to be doing.
Yes. Now, Saeed's is skeptical. Okay, so help us understand what. Okay, because we hear a ton of stuff about when it comes to animals and how to take care of animals. Some people say animals need a raw diet. Some people say animals need grain-free food or just I don't know, probiotics or acupuncture. I don't know, stuff like that. So what is unnecessary? What is not real, overhyped, and when it's actually life-changing?
So they need the same things we need, which is real food, So real food is real food is real food. So what we've been sold is that we're supposed to be feeding our animals out of a bag, and that it's basically an ultra processed cereal. So it would be like, if we know that our pets need the same exact things that we need, which is real food, real nutrition, vitamins and minerals, clean water, all the basic things that we need, they need the same exact thing. And if we were to feed ourselves an ultra processed food every single day, so it would be like us eating Cheerios every single day with no milk. So it's not fair, right? Would you want to eat Cheerios every single day with no milk? No.
That sounds gross.
And unfortunately, Cheerios is kind of a high end. So I'm talking that most people are feeding their dogs Fruit Loops every single day.
Oh my gosh.
A really bad ultra processed food. And then we expect them not to get sick, and we expect their immune system to work well, and it doesn't. So then what happens is, and what people don't understand is, owning a pet, it's property. So if you give your dog a food or a supplement or a medicine that ends up hurting them and killing them, and you decide that you're going to sue and you win, the judge says, how much were your vet bills? Because the animal's considered property and not considered this family member, which that's how I consider my pets, as family members. So they're not going to get the nutrients that they need. They're not going to be able to thrive on these ultra processed diets. And that's literally what we've been told we're supposed to give our animals. We're also told that we're supposed to vaccinate them every year, which we're not. We put pesticides on them and in them to keep fleas and ticks away, when that makes no sense, because the flea and tick actually has to bite the animal still. So we didn't prevent the flea or tick from biting them. They still are biting them. So it's just like everything that we've been sold is literally, I think the most important thing for people to understand is that the person who's teaching our veterinarians is also the people who are making the food, making the medication, and now buying up all of the veterinary hospitals. So they literally are keeping our pets sick. And I know a lot of this happens on the human side of things too, but I concentrate on the animal side because I feel like they need a voice. Someone needs to be out there telling the truth. There's plenty of us out there speaking up for the human side of things. So we need to remember that natural medicine, traditional medicine, Ayurvedic, traditional Chinese medicine, herbalism, homeopathy have existed for centuries. And in 1950, Rockefeller decided, oh, we can make medications out of petroleum, out of oil. And that's what he decided to do. And he basically canceled all of the natural things. It's now considered woo-woo or witchy or whatever it is. And it's not. It's the original medicine. It is what has worked for centuries. But of course, you can't make billions of dollars. I want people to understand that Zoetis is owned by Pfizer, which is the animal arm for their pharmaceutical company.
Wow.
They made $300.7 billion in 2023.
Boo.
And every time, so remember, if we know that this mushroom has this action, for instance, right? It's amazing for the immune system. It's anti-cancer. It's antibacterial. It's got all these beautiful things. And we go try to recreate that in a laboratory. Not only does it take a lot of time and a lot of science and a lot of energy, it takes millions of dollars. So what they're trying to do is to see if they can get that action of that drug that they created in the lab to do the same thing that that mushroom did. And they never can, because there's always a side effect. So sometimes they go through all of this years and millions of dollars on a drug, and they start testing it, and it has horrible side effects. I'm going to talk about a drug, just one right now. I know about a lot of them. One called Librela failed in the human side, so they can't release it because it's hurt too many humans while they were researching it. So what do? They come over and release it as an animal drug because they're not about to lose that millions and millions of dollars in time that they spent on developing that drug. So right now there's a drug called Librela. That's an injectable that's for arthritis that's being given to old dogs, recommended for old dogs by veterinarians. And people don't understand that a drug rep came in to the vet office or your doctor's office, sold them this drug. And when the vet says, hey, are there any side effects? They go, nope. When there's awful side effects. Now this drug's been out for a couple years. There's over 20,000 adverse events. There's 2 class action lawsuits now. It's still being prescribed every day. Even the FDA has written a letter to Zoetis, to Pfizer, to veterinarians warning them about this drug, and it's still being prescribed every single day, injected into dogs, and pet parents have no idea that there's even a side effect, much less that it's going to kill them. So we have to take responsibility for everything that we put in or on ourselves and on our pets. We should never blindly trust somebody in a white coat. They are taught a standard of care. You come in with this problem, we diagnose you with this, we follow these things. You get this medication, this treatment, this surgery, this whatever it is. So I'm
Following
not
procedure like robots.
exactly. And I'm not saying it's not needed. If I have a heart attack or get in a car accident or break an arm, absolutely. I'm even going to take some of those bad drugs that have the bad side effects because they are very important in emergency situations. But to give someone an antibiotic or a steroid or a chemical concoction every single day of their life without rebuilding the gut, without helping the detox systems and the liver and the kidneys get rid of those chemicals, it's terrible. It's terrible.
I'm just imagining my pet vet was here right now. What would they say? Maybe like something like, "Oh, ever since modern medicine for animals, they've lived to longer and longer ages, and now our
Bullshit.
pets can live older."
Bullshit. I can prove it to you. Our pets are not living as long. We may be living longer, but our pets are not living longer. This is what happens is first of all, people don't understand that our pets age faster than we do. So you've got a 6-year-old large breed dog. He's a 70-year-old. And people don't see that or understand that. You have a medium-sized dog. When they're 10, they're old. And when they're very small dogs, same thing. About 10 years old is when they start showing signs of aging. So people don't understand that, but they'll go in and they'll be like, I think he's slowing down. Or they've been eating the same damn processed food for 6 years. There's going to be repercussions, right? They're going to have diarrhea or vomiting. This is how I lost my first dog. At 6 years old, this happened. So when you go see your vet for diarrhea and vomiting, they give you antibiotics without even knowing that there's a bacterial infection or problem. They give you steroids because they haven't been taught about this master system, the endocannabinoid system, and they haven't been taught about diet and nutrition. If they did, sometimes they get like 6 hours, but I have now, in the 10 years of doing my podcast, have interviewed hundreds of veterinarians. We have hundreds of veterinarians that use and understand the endocannabinoid system and use plant, cannabis, mushroom medicine on a regular basis now. They go to it first. So I'm not making it up. So if a vet was here, it would depend what kind of vet it was. If it was a conventional vet, they would say, I'm crazy. Don't listen to me. I'm not a veterinarian. You're right. I'm not a veterinarian. I am the person who teaches veterinarians and doctors about this master system that they were taught nothing about and how it works and why when you interact with that system, you really can bring someone back to health and homeostasis. So when people go, you're not a vet, I'm not going to listen to you. I'm like, fine, you don't have to, but I'm the one that teaches vets what they didn't get to learn in school. If it was a holistic veterinarian, which a holistic veterinarian is like a naturopathic doctor in the human world, but a holistic veterinarian gets out of school, went to the same school that the conventional doctor went to, except they have to continue their education and they learn about traditional Chinese medicine, Ayurvedic, acupuncture, chiropractic, ozone, all of the wonderful things that are out there that have existed from the beginning. So I like to say that, but in my opinion, us taking control of our own health and not putting it in the hands of another person, especially a person in a white coat, is the most important thing that I think any of us can do. Because nobody knows our family, our kids, or our pets better than we do. And I just had an experience. I just moved. I got a new naturopathic doctor. I just did all the tests, this 5-6 tests, the spit, the blood, the poop, the pee, everything, so that you can look at it all. And then she went ahead and prescribed supplements. Every single one of those supplements contains additives and fillers that we shouldn't have. So I'm even now on the holistic natural side, and it's still a mess because our doctors don't know how to make medicine. So when you're buying a supplement that says veterinary approved or formulated by a veterinarian or a doctor, they don't know anything about formulating medicine.
Mm-hmm.
So why would that matter? Why do we trust that? So, like right now, these 8 supplements that my new doctor is prescribing to me, I'm now going to have to take it and go find the person or the company or the manufacturer out there who makes it without cutting it with additives, fillers, synthetic isolates, because it's all about the money. So now I make medicine, and now I know way too much about how things are done and how medicine is made. And I'm like, wow. And it's always all about the money and profits and how much can we make, off of this type of thing, and not about how do we really help this person get back to homeostasis and normal. Jolene agrees.
Yeah, 100%. Roof, roof. Said?
I wanted to ask about the medication that you're making. What kind of results have you witnessed from the treatments that you provided to the pets that you're working with? What's the difference between the synthetic medication that the pharmaceuticals are providing and the ones that you're making yourself?
Great question. So the first thing that I did and why I do what I do is that I cured myself. I don't have rheumatoid arthritis
Congratulations
anymore.
on that. That's
Thank you. I don't, and when you do that, I'm like a normal person. I did everything that I went to every doctor. I got every test done. They literally could not find anything wrong with me at all. I was told that I was so healthy. So I literally had to sit down and go, all right, what am I exposing myself to? What am I eating? And I literally wrote down everything that I did every single day so that I could find the pattern, find what brings me to having this inflammation attack thing. So I've been able to bring myself back to homeostasis by interacting with the endocannabinoid system. And I did that by taking out ultra processed food out of my diet, all the chemicals out of my life that they're in everything, shampoo, personal care products, laundry detergent, plug-ins, all that stuff is poison. Anything that has a scent, all of those things. So removing all of those and then using plants and mushrooms as medicine is how I got myself back to homeostasis. At the same time, my soul dog was a miniature schnauzer. He was diagnosed at age 9. At the very same time, I was diagnosed with rheumatoid arthritis with degenerative myelopathy, which is where it's basically inflammation of the spine and the back end, and they literally lose the use of their back legs. He went from not going up the stairs anymore to completely back to normal. And he lived to 18 years old. So
wow.
That our dogs are supposed to be living to 20. But what happens is that they start getting old, they become seniors, they go see the doctor and say, hey, he's got diarrhea, he's slowing down, I think he's in pain, he's not acting normal. And then that's where it goes wrong. They get prescribed that antibiotic, that steroid, that pain med, or they get that injection, and then they go downhill from there, because now the body has to deal with this. Not only were they not doing well, but now we've thrown in a concoction of chemicals that now the body has to figure out what to do with. So they don't get better. And the pain might stop. Let's say it's pain. Pain is the biggest thing. Arthritis. They're slowing down. They're not acting like themselves. What people don't understand is that pain travels or works through 5 signaling pathways. When we make a pharmaceutical drug, they just target one of those pathways. Cannabis, mushrooms, plants naturally interact with all 5. So you can take a dropper full of a full spectrum hemp extract or a full extract of cannabis, and literally, and you're interacting with all 5 pathways and get rid of pain. Instead of a pharmaceutical drug where it interacts with just one of those pathways and you have to take multiple. So you go in, how's he feeling? I still think he's in pain. They prescribe another pain med, or then another one. And now they're on 3 to 4 to 5. And I know this because I had a dog rescue So I would bring in these animals and they would be on a concoction of 5 to 8 to 10 medications. And I would literally wean them off of them, give them the natural stuff and real food, and bring the oldest, sickest dog back to homeostasis. So you name it, from seizures, paralyzed, IBDD, cancer, every type of cancer you can imagine. I've been able to bring animals back to complete homeostasis using diet, removing the toxins, and plant and mushroom medicine. So that's what I want people to understand, is that the person in the white coat doesn't have all the answers. You know, and you can find them, and it will help. So that's what I was able to do by learning just about this one system and about this one plant. And that's why this plant is so stigmatized. This is why, you know, we should be turning on the news every day and hearing about the newest research and all of the things but we never hear about it. And you guys think, oh, has it been researched? Is there any scientific evidence? Yes, there is. And what's crazy is that why isn't everybody asking that about the pharmaceuticals that they're given? Why do they blindly trust that because a doctor gave you a pill and it comes from a pharmacist and it comes in a little thing and you throw it in your mouth? Why aren't you looking at that research? Because I'll tell you what, you're going to be surprised what you find. Because now I know, I always knew how it was done on the human side of things. I try to concentrate on the animal side, but on the human side, they're not proving that drugs are effective and work and safe before they come onto the market. We all think they do, but the FDA doesn't work for us. The FDA works for the pharmaceutical companies. So you have to research, look into everything again that you're putting in and on yourself. And you can say, or your animal, and you can say, yep, I'm going to take those risks, or I'm okay with those risks. Or you could say, I'm going to do this, and I understand that I need to help my gut rebuild after this. I need to help my liver detoxify from these chemicals. Or you can say, nope, I'm not doing that at all. I'm going to go the natural route. And it's totally possible to do that route. So my biggest message is, you have a choice. Don't believe what one doctor tells you. There are different, in human, you can go to a regular conventional doctor, or you can go to an integrative or a naturopathic doctor, holistic doctor, and they all will tell you something different. And even then, like me, I've gone to a naturopathic doctor. She still doesn't understand. She knows that I need this combination of herbs, mushrooms, food that would help me. She just doesn't know who makes a pure, potent, therapeutic product. And that's where the next problem is that after you find the good doctor, now you have to find the good companies. And they're not easy to find, because most companies, supplements, are marketing companies. And they see an opportunity and they go, okay, these people don't want to take these chemicals. They want the real stuff. But then they take that real stuff, and it's expensive to make the real stuff when you compare it to the synthetic stuff. And then how do we make it affordable? Like, why would someone buy a tincture, over a bottle? Why? They don't know what this is. This makes no sense. Well, this is the purest form. And there's nothing in it. They're adding additives to save money. So I encourage everybody to go to something called the other ingredients or inactive ingredients on any capsule or pill or anything that they're taking, and make sure that you understand what those other ingredients are. Because oftentimes they're going to find things like silicone dioxide, microcrystalline cellulose. What those are, microcrystalline cellulose is a fancy word for sawdust, wood pulp, and silicone dioxide is a fancy word for sand. And what they're doing is they're putting them in this to fill up the capsule so that they don't have to put as much of the bioactive compound in there. So it saves them money. So that's why those things are in there. There's other things that help the machines work better that end up in your final product. Synthetic vitamins and minerals are in everything. It's ridiculous how it's basically 85% of supplements on the market, both animal and human, whether they have a doctor or veterinarian behind it or not, are useless because they're not regulated. Nobody's regulating it. Everybody thinks that if it's on the shelf, it must be safe and effective. And that's not the case at all.
Well,
it's just the product.
When we were kids, we were taught to trust authority more. Trust your parents, trust your doctor, trust your government, stuff like that.
Yep.
But now our generation is turned on that completely. And now we're, very skeptical and, fighting the man. But now it's like, now we have opened the door to all these different options, and we're trying to figure it out ourselves. What's the best way we can take care of ourselves?
Well, we're going back to the original.
Yes, it's this whole battle between us going backwards towards more holistic, natural health and lifestyles, and people that want to advance more technological, more futuristic, more medicine,
more money.
People, whenever their dogs get chubby, they give them Ozempic, stuff like that, right?
Exactly. That's exactly what they're doing. They're going, I went to a conference that literally was all the people in control, because it's the same thing. The same 5 to 10 companies that own everything. They also own everything in the pet space. So I went to one of those conferences, and they literally sat on the stage and said, and this is literally only 2 years ago, they said people are calling their pets fur babies. They are considering them and treating them like children. So they now know you will give them that Ozempic. You will give them whatever that popular thing is now, because you think it's the cure. You think it's the answer. You think that's the answer to the problem. It is ridiculous.
And they'll call it Pazempic, and they'll make it marketing and fun and have fun ads.
It's already out. It's already out, including now this year, we will have our first anti-aging drug for pets. We already have it. I already did it. I already did the research. That's why I know so much about research also, is because I went ahead and did my first piece of clinical research so that I could go through that experience and see what that was like. And that's why I know too much.
Okay.
I mean, I literally hired a researcher who has been doing it for 15 years. He was a conventional veterinarian before that. He does research for pharmaceutical animal drugs. So we hired him. He sat down with us and said, look, guys, I just want to, dampen your expectations. You guys seem really excited about this, but we're probably not going to show anything. We're not going to get any results. I'm like, what? I knew we were going to get results because I had already been using my formulations on my rescue for years and literally watched dogs with full-blown dementia come back to life, come back to being normal. So I knew I was going to be able to prove this. And at the time, there was nothing being offered. That's why I had a rescue filled with old dogs. It's because people literally give up. They've spent thousands and thousands of dollars. They've given them all these meds. They've changed their food a million times, and they're still suffering, and they just can't take it. And then I would get them and be able to bring them back to homeostasis. So then how do we solve that? Now we go, okay, your dog's old. Here's a drug. So they're literally making a drug, and they're doing just the same thing. We don't even have Alzheimer's drugs for humans that are working, much less for animals. So it's just another money grab. Same thing with oncology. Whole new thing. Didn't even exist 10 years ago in vet med. And now it's a $1 billion industry. So
I just wanted to make a quick comment about this. The big pharma, obviously calls natural remedies witchcraft, and they really hate on it and try to make people think that this is like a sort of evil or something of the sort. But in reality, they're actually the ones who are making the potions, wearing the big coat, and making this big disguised look. If anything, they're the witches, but the witches took over.
Exactly.
They're the ones who are making these.
Well, you've heard of projection, right?
Them out to people.
You've heard of projection, right?
Every
Right,
day,
yeah,
you know,
exactly.
You
confession.
call
Yes,
them
yes.
that. No, you're the one in there trying to figure out, replicate nature. Like the audacity, when you think about it, the audacity of man to think that they can recreate something that's natural and make it theirs and sell it. Like there's plenty of money to be made on doing it the natural way. Do you know what I'm saying? But there's too much
Yeah.
competition, so they're going to do it that way instead. So yeah. And then when you really start to think about nature and think about the fact that there are mushrooms and plants that protect our brain, that help our immune system, that reverse aging. That's incredible and that's beautiful. And why are we doing that? And why what we should be concentrating on is how do we grow these things so that they're filled with as many of those wonderful bioactive compounds as possible. But we're not doing that. So that's the other thing. So that's conventional, right? Over there, they're making
Right.
shit in a lab, a chemical concoction in the lab. Then there's the people that go, "Oh, we know about you natural people. We know about you holistics, and especially those that have dogs that are willing to do anything. Y'all will spend more money. So we're going to go into that category." So now we're in the natural category where let's say someone's going to listen and go out and buy a mushroom extract or adaptogens or nootropics. Well, guess what? That fact of the 85% on the market are useless, that is true. So they're going to come onto the marketplace. This happened with CBD and full spectrum, flooded with people who are all buying a white labeled, shitty product, mass produced product from somebody and slapping a label on it, making as much money as possible, and then leaving and jumping on the next bandwagon. So now you've got people who, mushrooms, for instance, every natural medicine has to be grown the way it was grown in nature. So mushrooms, for instance, most of the products are grown on grain in a plastic bag in a dark, dank basement, and they inoculate the grain with spores of the mushroom, and the spores eat the grain. It's called mycelium. It takes it over. They take that whole block of substrate, throw it into a grinder, grind it up, and call it a mushroom product. Ooh. That's not a mushroom product.
And that's so when you buy ashwagandha or lion's mane or stuff like that from Whole Foods, right? It's all going to be that, which is not actually the real plant.
So there's mushrooms. So mushrooms are confusing because they're a functional food and a functional medicine. So we'll just concentrate on lion's mane right now. So lion's mane is this beautiful, it actually tastes really yummy. I don't even like to eat them that much, and I make myself eat them. But lion's mane you can buy at a farmer's market. You can go to your Whole Foods and you can find that whole mushroom. Chopping that mushroom up, frying it up in some grass-fed ghee for like 25 minutes and eating that is amazing for your gut. Your gut, it will literally, 3 grams will feed your gut microbiota, the good ones, for 13 days. So if you can eat mushrooms every 2 weeks, you're doing good. Then as medicine, we take that same lion's mane and we have to do an extraction of that fruiting body. So the fruiting body is what we recognize as the mushroom. And then we do a dual extraction, which is hot water and alcohol. And we have to do alcohol to break through the outer layer to get to those medicinal compounds. But those medicinal compounds will only be in there if that lion's mane was grown on dead wood, which is what it grows on. Shiitake, for instance, has to be grown on dead logs. Chaga has to be grown on a live birch tree. If it's not grown on a live birch tree and it's grown on a bunch of grain, it doesn't even contain the betulinic acid, which is its most famous compound. It doesn't even have it in there. So that's what people don't realize. So we'll go out. Mushrooms are popular. Someone will listen to this show. They'll go out and they'll look up, type in lion's mane, and majority of the products that are going to come up don't contain any lion's mane at all.
Wow.
So the only way to know,
Saeed's going to pass out.
You see how a bad player can go, holy shit, this is awesome.
It makes a lot of sense because I've tried those stuff from Amazon, like those lion's mane
Don't ever buy
products or
any of your
things. I'm like, I don't know if it was like a placebo effect or something, or maybe just like, a small amount of, I was like, oh man, my cognitive side is actually increasing or whatever. I don't know, to be honest, if it was helping at all. I just thought like I was gaining more energy, but it could have been just a placebo.
Exactly.
But other
Well,
than
that's
that,
what's
there was
beautiful about
no
animals.
drastic
There's no
change.
placebo. There's no placebo effect in animals or dogs. They don't go, oh yeah, I think I feel better. No, they either do or they don't.
They don't have self-doubt.
No, they don't go, oh my gosh, thank you for giving this to me. My headache's gone. No, they don't. It either works or it doesn't work. So those that want to look, when you're dealing with mushrooms, mushroom extracts, CBD extracts, or full spectrum hemp extracts, you should feel them immediately. You should feel them when you take, and I'll send you my stuff so that you can see, and you're going to be taking a dog product and going, this is the best thing I've ever, why is it dog? All my stuff is human grade. It should taste good, right? Why shouldn't it? It's what they want. So yeah, make sure some things that you want to look for when you're looking for products is you want to make sure that you have a product that actually has mushrooms in it. So when you're looking at those ingredients and reading those other ingredients, the biggest clue is that if it says mycelated grain or mycelium in it. Sometimes it'll also say brown rice, something or whatever. You see any type of grain or mycelium listed in the ingredients, it's one of those grown on substrate products. So don't use it. And I'm telling you, it's very hard because there's literally 2 giant manufacturers in China that supply most of the products here in the United States. And then there's one person here in the United States who's trying to do what China's doing. So the majority of the products on the market are crap. So what you want is a dual extract of that mushroom, both hot water and alcohol. And you want to make sure that it came from the fruiting body, that they literally did the extraction from the fruiting body. Some things that didn't make sense to me when I went out to go find mushroom products was, okay, I found the dual extract, but why is it in a powder? It was in a powder because it came from China. And it's a lot cheaper to send a powdered product that I can hide additives and fillers in and send over to the United States. Then they'll never test it and put it in a capsule and sell it. So that's what the majority of the things are. Mushrooms are 80% water. So are we. So why I would dry it, it would put it through another process. So I believe in liquid tinctures. They're more bioavailable. What I do is called a spagyric method preparation. I literally found a myco-alchemist who is trained to do this. There's only like 3 to 5 people in the whole country who do this. And it's the best whole extraction of a mushroom that you can do. So we literally go wild forage. So we have professional people who go out in the Pacific Northwest to find these mushrooms to sustainably harvest them, and or we wild cultivate them, meaning we grow them the way they would grow in nature. So if it's supposed to be on a live birch tree, then that's where our chaga is going to come from. So what we do is we dry them and then we extract them with hot water. Then we extract them with alcohol. Then we evaporate the alcohol out because alcohol's not good for anybody, not us and not our animals. Animals actually do not have the enzyme to break it down, so it's much worse for them. So that's why we evaporate it out. And then we purify everything after the extraction. What's left is called the spent. We purify that and put it back into the extraction so that it's a complete whole extraction. So yes, it's better than most human products on the market, and it certainly is better than a pharmaceutical drug. So when you look at not only the benefits of medicinal mushrooms and the research that's out there that proves how incredible they are and that they've been used in medicine, and that how many pharmaceutical drugs are taken from compounds that are found in mushrooms and plants. But I did it. So I did a piece of research on my Clarity formula, which is a nootropic. Nootropics are adaptogens, which I don't know if you know what adaptogens are, but adaptogens are plants and mushrooms that when we take them, the three of us could take the same exact tincture and all three of us would have a different effect because it adapts to what we need. Mm-hmm. So whatever our body needs, it's going to help that first. So what nootropics are, they're adaptogens that are all for the brain. So lion's mane, reishi, cordyceps, an herb called Bacopa monnieri, astragalus root, they have already been proven to be anti-aging. So Bacopa monnieri and lion's mane extracts, for instance, inside of our cells, our DNA, we have these little cross things called telomeres. And every time our cell replicates, they shrink and they get shorter, and that's what causes aging. Mm-hmm. Bacopa monnieri and lion's mane extracts have already been proven to regrow those telomeres. So literally reverse aging. They also regenerate neurons and neurogenesis. These are mushrooms and plants that are doing this. Wow. So I already had that research, which is why I put the formula together and then went and sought, how do I need to grow them? How do I need to extract them? Put them together, started using it, because I don't know if you guys know how you die from Alzheimer's. Do you know? Because most of us think, I certainly did, thought it was a memory disease, right? You just forget how to do things or who you are or whatever. You forget how to eat and drink. Mm-hmm. And that is how you die. Mm-hmm. You're still hungry and thirsty, but you don't know how to chew and swallow and eat or drink. And I watched this with dogs and I was like, there's got to be something. So this is why I created what I created. Also seeing that there's nothing on the market for humans or animals for this. When people are going in and going, my dog is wandering around at night. My dog is just not himself anymore. The doctors were literally saying there's nothing else you can do. And now there is. There absolutely is.
I mean, if you have like no other choice, you might as well try this, you know?
Absolutely.
I think a lot of people have so much stigma around plant medicine and mushrooms and cannabis. Can you tell us a bit more about how that works? We understand the endocannabinoid system for human beings, but how does that work for animals? And
same exact way.
Can they like overdose or take too much of it?
No, great question. I want to answer that question, but I would love to share with you the results of a research study.
Go for it.
Because we brought on dogs that had severe CCD, which is Alzheimer's doggy dementia. Mm-hmm. So we brought on dogs that had severe dementia, mild and moderate CCD. And the dogs that had severe didn't get worse. And those that have had an old dog with CCD or dementia, it gets bad fast. Like within a couple months, it just is a downhill if you don't do anything. Those that were mild or moderate improved. So we had an 81% improvement rate on dogs with dementia. We reversed it. We tracked them with activity collars so that we could see heart rate, activity, because a lot of them pace around all day, stand in corners and bark, or they're up all night. So we tracked, are they sleeping better? How is their heart rate? We also did 2 blood marker test labs. So we tested something called CRP, which is C-reactive protein, which measures inflammation in the brain. And we did something called BDNF, which is brain-derived neurotrophic factor, which is basically proving that we are regenerating neurons and neurogenesis. And we also did parent surveys, so they could say, yep, eating normal. Yep, back to his normal routines. Yep, sleeping through the night type of thing. And what I realized is that most research for animals, all they have to do, and this is from my researcher telling me this, first of all, I brought him on my podcast to interview him because he wanted to meet the witch because this was his first time in his 15-year career he had ever done research on a supplement and it actually do what it said.
Mm-hmm.
It never experienced that because that is not their purpose when they do it. Pharmaceuticals for animals, I'm not quite sure what the hell they're doing on the human side of things, but for animals, they just have to prove that the health of the animal doesn't change the first 3 months. Not that it actually works and does anything. They just have to prove that it doesn't make the animal's health worse. I looked up all the research, that drug I mentioned before.
Mm-hmm.
I only did 3 months. You know what they did? And this is Pfizer money. I don't got Pfizer money. Pfizer did pet parent surveys for 3 months for Librela. They never have to prove that it actually does what it's supposed to do and that it's safe. And that's what I want people to understand. So back to your question, which is, can we overdose?
Mm-hmm.
Can an animal overdose? If we're dealing with pure plant and mushroom products that have a COA, a certificate of analysis, that from a third-party lab that proves that it is safe and free of contaminants and that it's actually what it is, it is impossible. In animals, they literally, well, they did it for humans. So in 1973, there was a study called the Rosencrantz study where they wanted to see how much THC it would take to kill a person. And of course, in most research studies, they tested on animals. So they tested it on labs, beagles, and chimpanzees. They gave them 9,000 milligrams of THC, right? Can you even imagine? I can't. 2 rats died in their sleep. They regurgitated and asphyxiated themselves on their vomit. Had nothing to do with the THC. No beagles and no chimpanzees died. And the chimpanzees actually within like a month metabolized themselves, so they weren't even acting high anymore. So it's called LD50. There is no lethal dose because these products, if they're tested and made right, are pure and they're natural, and the body knows what they are and knows how to go, I got too much of this. I know what this is. I'm going to send this out. Versus when the liver comes across a synthetic chemical, it confuses it. It makes it work harder. It doesn't know whether to eliminate it, whether to store it, whether to put it in the fatty tissue, which is what it does. It gives up. And in dogs, because I wanted to know, why do all these old dogs have lumps and bumps and cancer and tumors all over them? That's when the liver gives up, doesn't know what to do with the chemical. It literally goes and stores it in their fatty tissue. And then what do? I don't. But what do people do? They go to the vet and go, what is this lump or bump? Well, it could be cancerous. We could remove it or we could aspirate it. And now you have stuck a needle in or cut open something that has been holding toxins for years that the liver had put there. And now you've overwhelmed the body, or actually, if it is cancer, you've helped the cancer spread. So letting the body do, supporting the body's innate ability to heal yourself is the best thing that you can do. And chemicals don't do that. Nature does. Food does.
Wow. Can I continue on that and talk about anxiety in animals and how do these plant medicines interact with the anxiety? Do they make it worse or better? How do pets get anxiety? Is it genetic or is it environmental? Is it something to do with the owner and how they are with the animal? Yeah, go ahead.
Yeah, anxiety is just the system not being in homeostasis. You know, whatever it could be inflammation of something, but that is what the endocannabinoid system is responsible for. So that's why you're like, how does something that gets rid of pain, kills cancer, also helps with anxiety? It doesn't seem possible, right?
Yeah.
But yes, Mother Nature has given us this incredible plant. The endocannabinoid system is responsible for keeping us at homeostasis. So if we're anxious, we're in pain, whatever it is, we're not operating at homeostasis. So this system has receptors all over our bodies. So they've actually renamed it the endocannabinoid ohm because now they incorporate the gut microbiome as part of this master system. So we have receptors on every organ, all over our skin, all through our gut, our brain, they're everywhere. And the two main receptors are the CB1 and CB2 receptor. And we produce endocannabinoids. When we aren't producing enough or the right amount of endocannabinoids, we start having problems and we're not at homeostasis. Mm-hmm. So that could come out as anxiety. It could come out as pain. And that's why it seems so crazy that this one tincture you can take, I took it for my rheumatoid arthritis to get myself back to normal, get rid of my pain. And at the same time, my anxiety and stress levels went down. So that's what's supposed to happen. And that's why it's so villainized, because one plant would wipe out the majority of pharmaceuticals on the market because it does everything. Look at right now. Hemp is supposed to be banned next November. Hemp. Why do you think that is? Because people are not taking opioids anymore. They're not taking pharmaceuticals, and they're not even drinking alcohol anymore. Because hemp is doing the trick. So now they made it federally legal in 2018. And now in 2027, what year are we in? 7, 26. They're going to try to get rid of it.
Wow.
Not the bad shit, the good shit.
Yeah, hemp is supposed to be very natural, from what I understand.
Hemp, the stuff that doesn't even get you high. So now they literally snuck in to the big, beautiful bill or whatever to open up the government. And it was all from the Kentucky Congress, Senate, I don't know what the hell he is, that was getting pressured by the Kentucky liquor industry because sales are so down and that can't happen.
Wow.
So literally people are finding relief for themselves and their pets, and now they're trying to take it away. And people don't even know that it's happening. But there's states right now that you can't buy a full spectrum hemp extract in. And that's screwed up.
Saeed, anything else you want to comment on this before I have one last question too.
No, go for it. I think it's just pretty crazy to hear all of this.
It was pretty. It's pretty crazy to discover all this. And what's crazy is that I never considered myself a disruptor, but as I discovered it, I brought it to light, talked about it, brought on other experts and whatever. And yeah, I mean, I've been canceled by people because I understand I am calling out. It is really hard to find pure and natural supplements on the market because I think everybody goes, well, they're getting away with it. They're cutting it. They're putting it in there. Mm-hmm. Everybody does it. Literally yesterday, I sat down with 5 of my team members. I told them to bring their supplements. They brought their supplements. They're all pretty savvy, right? Because they work for me, so they know how to. And not a single one did not have a harmful inactive ingredient in it. Not a single one. And that's what happens is, how do you compete with that? Right? I have to spend the majority of my time educating people on how to pick a supplement that's going to help them. Because what happens is that I'm dealing with people who understand real food is what we need, that they're feeding themselves and their dogs or their cats or their pets real food, yet they're still not getting back to homeostasis or complete health. And it's because of those hidden ingredients or the fact that everything's in plastic. Mm-hmm. You know? So should be in glass, should be liquid, shouldn't have anything in it harmful, especially if it's a natural holistic. But again, the bad players are over here in the holistic natural market because they know people like us are going to spend more because we want the good stuff.
Well, because we're also desperate too. We're desperate for answers. We're desperate. We want to be healthy and we want our animals to be healthy, and we're looking for any kind of solution. We're looking here, we're looking there, and it's all kind of corrupted. I want to ask you about the executive order that was signed about the FDA speeding up breakthrough therapies like psychedelics, ibogaine, psilocybin, LSD for conditions like PTSD, anxiety, depression.
I'm going to go addiction. Like this while you do it. That's my eyes rolling in my head.
Okay, tell us about that. what should we?
So
how
it
should we
sounds
interpret that?
promising, right? Like my phone blew up every time it happens. Every time the president comes out and goes, "Hey, this is a legit medicine," whatever. So all that's doing, unfortunately, is allowing pharmaceutical companies to do research and create drugs out of the compounds found in cannabis, mushrooms, psychedelics. Because the research that is out there has proven that they're incredible, but in their real natural form, not isolated. So they've already made a pharmaceutical out of CBD. So they took, so I didn't finish. So remember I talked about the endocannabinoids. Our body produces these endocannabinoids. When we're not producing these endocannabinoids, we have an endocannabinoid deficiency. Some of the first times we get our endocannabinoids are from our mother's breast milk. So if we weren't breastfed, or our puppy or our kitty wasn't breastfed, they could have an endocannabinoid deficiency at birth, as a baby. And if we never fix that, that could turn into something else. Or as we get older and we don't do anything and we're not producing these endocannabinoids, that's when we start experiencing the pain, the inflammation, the anxiety, all of that. When that happens, there's this beautiful plant called the cannabis plant that produces phytocannabinoids. So we take these phytocannabinoids, they fill those deficiencies, and we get back to normal and homeostasis. So that's why it works for so many things and seems so incredible. But people need to realize that CBD and THC are the main phytocannabinoids that feed our system, but there's 118 of them discovered. There's a whole bunch more, but we've discovered 118 now. But there's also thousands of terpenes, flavonoids, fatty acids, proteins, all of these other compounds that only when they're all together will this cannabis medicine do all the things that I'm saying it will do. What this new thing does is allow them to take this beautiful plant and isolate everything and then make a drug out of it. So we already have an isolate of CBD, which they went into the lab and created a synthetic version of CBD. It has an action, but it also has horrible side effects. It causes liver injury. Why? Because the body no longer knows what it is. It's now a chemical and not a plant compound. So all that's doing is allowing giant pharmaceutical companies without any risk, because now it's legal, right? Now we can research it. Now we can turn it into pharmaceutical drugs. So it sounds promising, but it is not. We already got the pure stuff. You need the pure stuff. You need it with all of its compounds. Isolating, like, will we find out one day that the isolate of CBG stops your eye from twitching? And we can use it for a drug for people who have horrible eye twitches. Sure. But there's also going to be a side effect to it. And you could just go get a plant that is high-end CBG instead and take that and then have all of the other cofactors. It's called the Entourage Effect. And it's with every plant and mushroom medicine that is out there. You can't just take away parts and expect it to work the same way. It doesn't. It's like running your car and not putting oil in it and thinking that it's going to keep on running forever. It's nature, and you can't mess with nature. You can't split it apart and think that it's going to have the same outcome. So unfortunately, no, I'm not happy about that. My eyes rolled because we deschedulized it, but we just took it out of one. They just made it so that Big Pharma can research it and make drugs out of it now, out of mushrooms and plants. Those mushrooms and plants.
Wow.
I think that's why they call it Mother Nature and not Father Nature. So they should keep nailed out of it because they're turning it just a capitalistic aspect. This woman deal with the treatment. From what I've noticed, they're much better at it. Men just want to make money out of the treatment.
And you know what?
That's my
And I'm okay
opinion
with
on it.
that. Go do that, right? What I have a problem and why I sound so angry is that they want to stop me from educating you and doing what I'm doing. I chose the holistic pet space to avoid. I have one of my heroes was a whistleblower for Big Pharma. She's dead. She was found mysteriously dead. And she told everybody, if I'm found mysteriously dead, they killed me. Because she worked for Big Pharma and quit after she found out how they were doing everything and then was a whistleblower. If you guys knew the bullying, threats, lawsuits, cease and desist, cancellation that I have gone through by purely just exposing the truth in the pet space, you'd be amazed. So why can't this witch just come over here and do her thing and educate and make medicine and tell everybody how it works peacefully? Why do you have to shut me up? What are you so threatened by? That I'm going to actually get people to, I already know why. Again, one plant, one mushroom would take the place of most pharmaceutical drugs. There's a piece of research that came out, gosh, I think it's 2022 now, that every single time a state became medically legal, medical marijuana became legal, Big Pharma lost 1.5 to 2% of their revenues.
Wow.
That's billions of dollars. They ain't interested in that.
Mm-hmm.
So,
and the alcohol industry too is suffering because of all that too. Mm-hmm.
So that is why it's being kept from you, and that is disgusting in my opinion. And I know there's people that want to pop the pill. There's even people that popped the pill or had the chemotherapy and, it saved their life. But there's those of us who want to do it the other way. And we should be able to have that choice, and we should demand that choice. And we should never put our health in someone with a white coat's hands, because they don't know everything. You have to know everything. You have to do your research. And even that, finding your research is hard, right? Because it's all about marketing. It's all about you Google something, and it's all about who's going to pay for their information to be found. And AI, even worse. It's who he with the most money is going to put that message out. So it is not easy. It's if you decide to go this route, it's really hard, but I've been in it for 20 years now, and it's actually getting easier, because I just was on someone's podcast, a pet podcast, and he had a whole bunch of supplements that someone sent to him. He goes, "Hey, tell me about what you think of those," because now I'm a supplement expert. And I looked at him and I said, "I don't even have to pick it up and look at it." He goes, "Why?" And I go, "Because I can recognize the cheap plastic container that it's in. And I know it's a white labeled mass produced product, and they don't give a shit. And it's a powder with a whole bunch of craps and isolates put in it." So it's just, I operate in the holistic natural world, where now people stay away from pharmaceuticals, but they're going more natural. And I watch these supplements where they have the natural stuff in it, but then they isolated the one compound and they threw that in there, and you've messed it up. You messed it up. It's like saying, why do we eat blueberries? Oh, they are packed with antioxidants, right? Only if that blueberry was grown the right way, right? And do you know that chaga has more antioxidants than anything else? But you don't know shit about chaga. And then when you do, the people who hear about this are going to run out and go find chaga, and it's not going to be grown on the right thing and not have any. Do you know what I'm saying? Like it's exhausting. And I hate when people find out about something, try it. Like all I heard was, I tried CBD. It didn't do anything. I'm like, show me what you took. I'll tell you why. Oof. Does it have a COA? Doesn't have a COA? Don't put it in you or your family or your animal, because they have to prove that it's natural. FDA isn't making sure it's safe. Nobody's making sure it's safe. You have to make sure it's safe. You have to make sure that it even has what it says in it. So I know It's exhausting, but it does get easier. It does get where you're like, oh, tinctures. I love tinctures because they don't have all of the fillers and additives. It's a lot harder for them to put in it, but most of them have alcohol or 50% alcohol or, those types of things. But same thing with tinctures. I can look at a bottle. If it's not in an amber or cobalt blue bottle, nope, they don't know what they're doing, because we've got to protect the ingredients inside that from light and heat and things like that. So it's the same thing. Or I see something that's clear. I see a mushroom extract that's clear. What? So it does get easier. And I know it sounds overwhelming at first, but it does feel like the world is against us. But it's capitalism. And Mother Nature has made us all the food and medicine that we need. And we just got to find the people who are not messing with it and cutting it with something, and that can prove it in a COA that it's free of contaminants.
Hey, I'm optimistic that the future has, I don't know. I think we're going to be able to fight back, and with our collective knowledge and
well, this is what happens. What happens is the people do know better. And there's enough of us that know better and that read labels and choose. But what happens is those good companies get bought by one of those 10 that are in control of everything. And then they start changing things because they go, like for me, you can go out right now. You can go, I'm going to make a lion's mane tincture. Oh, I'm sorry. Let's make it chaga. I'm going to make a chaga tincture. So I can go out to a mushroom supplier and get, how much is your chaga? And I can get prices from $5 a pound to $80 a pound. What do you think the difference is? One's grown on grain in a plastic bag, and one's grown on a birch farm where that's all they do is grow chaga on live birch trees. So you don't know that as the consumer. So it's even that, like, that's how corrupt and messed up it is that you're going to have the people that are there just to make money, and you're going to have the people that are making real medicine. And the people that are making real medicine, it takes a lot longer for people to discover it, because what happens is people go, no, have you tried this one? This one works. Word of mouth gets out, becomes big, popular, whatever. Then the big company comes in and buys you. And then they come in and go, what the? Are we paying $80 a pound for this mushroom when we can get it for $5? So then they changed that. And then all of a sudden you're like, I don't understand. I don't think it's working anymore. Or I think something's different or whatever. And that's literally what happens. So it's like, you got to follow your good brands and then keep up with, have they sold and are they going to change anything in it? Because most likely they are. And that's what happens to most of our favorite natural brands.
Wow. Syed, anything else? I mean, you want to add?
It's definitely very eye-opening, because you don't hear about this in mainstream media, obviously, because it's mainly what comes out of pharmaceutical companies and all that. Angela, we really want to thank you for sharing all of this knowledge that
Thanks for letting
you've
me.
personally done your own research. You're an expert in your field, and definitely sharing this alternative media that people should know more about. And this is what we try to provide here on this podcast. We try to provide the other perspective, the ones that people don't know about or don't hear about.
Exactly. Trust no one, question everything, you have to read those labels of what your food and your medicine and your supplements, and understand what's in them and what the side effects are, because you're trying to get better and you don't want to make things worse. So, and I know it seems overwhelming, but once you start, it really does start to get easier to identify the good versus the bad. You'll find community, you'll find trustworthy look at why podcasts exist, right? Because this information is not being shared. I literally did a clinical piece of research thinking that would legitimize me and get those that don't want to talk to me because I haven't proven it. I did. They still don't want to hear from me. They still don't want to hear from me. Because remember, when I say do this, check this, then that means all of these others are now no good. And I'm a disruptor. You know, it's good, not good. All right, thank you. I have someone knocking on my door, so I can.
All right,
I'll go. But thank you so much for having me, and thank you for doing what you do.
Until next time, Angela.
No problem. Anytime.
We're out.
Guys, thank you for watching another episode of A to the Show. We'll see you guys next time. Peace.
Thanks.
Peace.